Good afternoon. I'm Dr. Amy Thompson, and I'm the Chief Executive Officer at Covenant Children's Hospital in Lubbock, Texas. And I'm so grateful to be back again with you guys this week to talk about some more COVID things. So first of all, I have to just read a bit of a disclaimer. So as a reminder, the information provided during this event is for informational purposes only. And if you have questions around the COVID-19 pandemic, please visit our website at providence.org for medical updates. And this event does not create a doctor-patient relationship, and any questions or medical advice discussed should not be considered guidance on what you should do. For any medical questions, please reach out to your primary care or healthcare professional. So thank you guys for joining us today. It is my pleasure today to introduce to you Dr. David LaGrue, and he is the Executive Medical Director for Women's Services at St. Joseph Health. And so Dr. LaGrue, thank you so much for being with us today. And actually, I'll just start it off by saying, tell us a little bit about what it is that you do there at St. Joseph Health and just some of your background.
Sure. Well, thanks, Dr. Thompson. I'm a maternal fetal medicine doctor by training, but right now I do mainly administrative duties here in the Southern California region with our 11 ministries that deliver and help organize for moms and babies and things of that nature. So a lot of quality improvement, a lot of cost containment, a lot of helping people get through various things. And obviously in the midst of the COVID pandemic, my role has been to educate and help the various hospitals and ministries develop their protocols and things of that nature to deal with it.
Fantastic. Well, thank you so much for being with us today and for serving as our subject matter expert on all things women and COVID. So I'll start off with just an easy question about, what have you seen? So, have you seen pregnant women, new mothers who've had the virus, and what has your experience been with that?
Yeah, I would say, and we here in California, as you know, we through our social distancing and things of that nature flattened the curve. So we never reached the sort of panic numbers that they had on the East Coast and things of that nature. But having said that, we've also unfortunately not seen the drop off yet. We're in sort of still the flat part of the curve, if you will. And so what that means is that we see a number of women who have developed symptoms during pregnancy and need treatment. Just a few that have had to come in the hospital. We've been very fortunate. We have not had a whole lot of extremely sick moms that would have to go in the ICU. We've also seen a number of folks who did not know they had it and came in and through screening tests had positive tests that we've had to deal with. And then of course in our world we have we have two patients, right? So or three or four depending. And so we have to be ready to help screen the baby and protect the baby as well. So it's a bit of a different spin than the adult doctors deal with. But that's why I went into maternal fetal. It's definitely an interesting field.
Fantastic, thank you. And we take care of women as well here at the Children's Hospital in Texas, and we've seen very similar things to what you're describing. In terms of some asymptomatic folks. And we also have had very low numbers of those pregnant women who've ended up like in an ICU setting or actually very, very low numbers for that. So talk to me a little bit about, pregnancy as a whole. Is there something in pregnant women? Do you have a higher chance of contracting, the coronavirus? Does it matter how far along you are in pregnancy?
And you described your experience and our experience. And I think that agrees with the literature that there isn't, fortunately, knock on wood, unlike some things like varicella and influenza, where you can get quite ill just because you're pregnant and have the infection. I wouldn't put COVID-19 in that category. And, the early data that came out of the few cases in in China showed that there were a few patients that would get extremely ill, but in general, they didn't see a lot. So I think what we're always trying to tell patients is, the good news is it's not going to, pregnancy won't make it worse, but the bad news is it doesn't protect you either. So to a certain extent, that you still have to worry about it, and obviously we take special precautions, et cetera. But fortunately, it's been pretty well. And same experience, if you look at the effect on the baby, there doesn't seem to be so-called transmission, in utero. If there's going to be transmission, it's much like we see with influenza and others where it's a respiratory spread after birth. And so that allows us to take precautions and things that nature and reduce transmission to the baby.
Yeah, great. Thank you so much. So if you're a pregnant woman and you're watching this and you're worried that you have COVID, what is it that you would suggest that they do?
Well, obviously, if they've had an exposure or they had any of the typical symptoms, of the loss of smell or taste or cough or shortness of breath. Telling pregnant women, call us when you have fatigue is doesn't work real well. But seriously, if they have any symptoms or they've been around folks that they know to have it, certainly should get screened with testing, just like we tell people who don't have it, and they certainly should consider, quarantining themselves, meaning don't go out and commingle with anybody. And so it's general guidance, kind of like what the non-pregnant world is. But again, we have the nuances of some of the subtle symptoms can be so similar to pregnancy that it makes it a bit confusing.
Yeah, I agree with that. So I've had a lot of questions just from even, some of our patients and, folks that are in our outpatient clinics that are pregnant that worry about the safety of hospitals and worry about, is it still safe? Is it safe for me to come to the hospital to have my baby? So what is it that you would say to those women?
Well, the first thing to tell you is they're not alone.
Yeah, that's right.
I think for many, many weeks, the staff was scared to come to the hospital, right? We didn't know a lot about the virus. We didn't know a lot about the transmission. Obviously, we all scrambled to get enough protective equipment, et cetera. So in the early days of the pandemic, at least for us, it was really about controlling fear. And like I say, not just the patients, but as well the staff. Today, with enough protective equipment, with what the knowledge base we have on the virus, it's made a hospital a very safe place. I always, my advice is, you're asking me that, and you're going to the grocery store. I mean, the reality is you're a lot safer in one of our labor and delivery units than folks would be typically doing a lot of places they're going to for everyday life. So having said all that, certainly as you know, it's taken an effect. I mean, in the non-pregnant world, there are people with heart attacks and strokes and all sorts of things that didn't come in soon enough. And so I really try to encourage patients, have that conversation with your doctor or your midwife. And I think, we've used telemedicine a lot, and I think you make more phone calls, and there's lots of safe ways to have communication these days. And, if you are concerned or whatever, you should understand we're making it as safe as we can. Unfortunately, there's some side effects to that. Yeah. The other big controversy is, for years, and I'm one of the guilty parties, hey, make sure you get all your family in on this and make sure they come see the baby and let's get this family started well. And then all of a sudden whoa, wait a second. Yeah, we may let your husband or your significant other or whoever, your loved one, you want to have that one person come in with you. but everybody else stays at home and watches on the iPad and looks at the pictures. So that's been a real problem because, again, I think the expectation most young women have today of having a baby is having the whole family involved.
Yes, I think so too.
So again, in our effort to make it safer, now, having said that, you and I were talking just right before we went on, if you look at the experience in New York, the mother who was positive 60% of the time, the dad had positive for virus as well. So we do know it's all about reducing the number of people you're around to reduce the infection risk. And so we have to do these things.
I agree. And, one of the things that I've really liked, being part of the Providence, family of hospitals is Providence has done a really good job of putting out a lot of things. And, the latest thing that I saw was, the 7 steps that hospitals are taking to make sure that you're safe, when you come in. And to your point, I actually feel like I can confidently say that I feel like people are more safe coming into my hospital than going to the grocery store, and exactly the thing that you and I were talking about. And so, underscoring the stuff that we're doing in the hospitals with everything from screening to limiting visitors, to absolutely making people adhere to masking, policies while they're here. Certainly we're taking a lot of precautions even on the floor. And so I actually worry much more about people once they go home than I do when they're actually inside the walls.
I do too, because again, obviously the natural thing is, right, everybody comes over to see the new baby and things of that nature. And again, the downside to that is, unfortunately, every person you're exposed to is potentially a risk.
Yep, I agree. What about any other special precautions? Are there any uniquely special precautions that you're taking in the hospital that are unique for patients that are coming into contact with pregnant women?
Well, again, similar, we follow all the CDC guidelines and different things on protective equipment and visitation, et cetera. I think the biggest spin in labor and delivery is, what are the precautions you take with the baby after birth? In other words, if they're negative, then obviously, you don't have to worry. On the flip side, if they're positive, then you have to have a conversation with the mom about separating the baby so they don't transmit it. Or if they decide, we actually have, that's a real place for shared decision making, because what the data shows is actually the risk is not huge. Babies, for whatever reason, well, anybody under 20, it's a great time to be a teenager. But anybody that young, the risk of transmission and the risk of serious disease is pretty low. But having said that, it's not zero. And so we have to have those conversations with our moms if we find out they're shedding virus.
Yeah, I agree. And we're doing the same thing. I love that you mentioned shared decision making, because that's something that we're really encouraging, are those kind of conversations with the mom to talk about the risks and benefits in both directions. And there's certainly risks and benefits to either separating yourself from your baby or not separating yourself. And so making sure that we're including the moms and significant others in making that decision. I'm always a big fan of, shared decision making. What have you seen? Are you having, I would say I'm split. I have about half of our cases that I feel like have chosen to keep the baby with them with precautions, and then about half that have chosen to, do the 2-week, have someone else, take care of them.
Yeah, I would say here on the West Coast, it's actually more choosing not to have separation, other than place the crib 6 foot away, and when they're handling the baby, put a mask on, wash the hands, wear a gown, that sort of thing. And then of course the other question, the natural follow-up to that is, what about breastfeeding? And we know I think the folks, the powers that be are pretty clear on that the risk of that is pretty low, and the benefits are still pretty high. And so in that conversation, it really weighs towards still breastfeeding. But again, there are people, it's an interesting thing. There are people who absolutely, oh my gosh, if I gave my baby something, I couldn't stand that. And, I'm okay with not being around it. And then, of course, you have folks that bottom line is they don't, that they've read enough or understand enough to say, gosh, it's a small risk and I just have to be near my baby.
Yeah. So let's move a little bit the conversation and let's talk some about the baby. So, we have a mom who comes in and she tests positive for COVID, and then she has the delivery, and that baby actually has to end up either in the NICU or in some type of special care nursery with that. What happens in that situation?
So again, as we I think talked about, the baby themselves is unlikely to come out with overt infection. All babies, regardless of their gestational age, would then be screened at 24 and 48 hours with testing, and then if negative, obviously managed that way. I think the tricky thing is, and again, we talked earlier about this is actually fairly low numbers, but obviously there are women who earlier in pregnancy, either their water breaks or they go into premature labor, or they're just so sick that we're really worried about them and deliver them. And so in those cases, especially with an extremely premature baby, it's the prematurity that's the big risk, actually, more so I would say than the infection. But clearly it's not good. And again, it's much like we were talking about with the mom. Then you run into, again, in special care nurseries, we've really tried to incorporate the parents in the care and around, and we just can't do that. So I think it's interesting. Our nurses, and I don't know for you guys back in Texas, but our nurses a number of them have gone out of their way to say, you know what, Mom, Dad, we're here to care for your baby, and we promise you we'll give them love and attention and everything we can do. And they have really stepped up to make that part of their job.
Yeah, I agree with that. I feel like this question for us has been the hardest question, which is when you have a baby in the NICU, by definition, those parents are going to be very, very worried. And then you have a mom who's testing COVID positive, and obviously we can't let that mom into the NICU, with other babies. And so I agree with you. We've had a lot of our nursing staff step up. I have never used so many iPads in my life to make sure that, family and friends could see what's going on. We do, interestingly, we've got some cameras at the Children's Hospital, Nicu Cameras. And so we have those already in our NICU, where typically we use that for other family members, or so that someone's able to see their baby when they're not there. And we certainly, that has been a blessing for us to have something like that, so that those moms are able to see those babies.
Yeah, I think you're going to see more of that. We're testing out certain cameras and different things. So even in labor, and even with people pushing and things of that nature, obviously camera angles are an issue. But there and in the mother baby units, try to get folks in. It's funny, we actually have done that in labor and delivery when like the dad's been deployed overseas or stuff. And it actually, I mean, it's not the same, I get that, but it's definitely a lot of fun for, the right people. Obviously, it's another shared decision making with the patient herself, because she's the boss. She gets to decide.
That's right.
Is the bottom line.
Well, let's talk a little bit about, we were talking some about babies. So if a mom takes, a baby home, irrespective of if she has tested positive or not, what kind of symptoms are they different than the symptoms that she, should be thinking about? Obviously, you can't ask your newborn if they can still smell, and those kind of things. So what are the things that they should be looking for when they take a child home?
Yeah, I mean, I think to your point, you can't ask them if they're tired. You can't ask if the formula or the breast milk tastes the same, right? So or they can't taste anything. So really you're down to what's their breathing, how irritable, temperature, all the different things that babies do. And I think what most of our pediatricians say is you just got to be on the safe side. So if there's something funny going on, you call us sooner rather than later. Again, for the most part, not a lot of people have seen sick babies, and so the good news is the risk is probably pretty small. But again, if it's your baby, it's 100%, right? So you really have to be careful.
Yeah, I agree with that. So I'm still a practicing pediatric hospitalist. So actually, when I'm still on the weekends, I've actually been some of the one taking care of some of those babies, to the positive moms, and that's exactly the thing that we tell them, and the thing that's difficult, and this is difficult in all kinds of illnesses, not just COVID, with babies, is there's a reason that we have specific criteria that make us worry, that babies are sick, and those are very non-specific. Temperatures greater than 100.4, and we just call it generalized fussiness. And, if they're not feeding well, babies just have very non-specific signs, that they're not well. And so I think making sure that those folks stay in contact with their primary care docs and are really making sure, even like you said, taking advantage of some of the telemedicine and things like that they can do to make sure that they don't need to bring, that child in.
Yeah, I think the message for the pediatricians in the same way, I mean, we say it as obstetrician gynecologists, the only time we'll get mad is if you don't call.
Yeah, that's exactly right.
In other words, you have to leave that expectation that, hey guys, if you got a question, I'm worried, right?
Yeah,
because, mothers know. The dads, not so much, but the mothers know. That's my philosophy.
I agree. And I used to laugh in residency that there was a particular nurse that we had that worked in our newborn nursery. And when she would call us, she would say something very nonspecific like, Dr. Thompson, this baby just isn't looking right. And that was enough that we would come upstairs knowing that, so they can have these very nonspecific signs that, that can mean things. Okay, so this is the question that all the mamas and all the mother-in-laws are out there. And they're like, okay, so you're not letting me in the hospital, which we understand. But when is it okay for me to go? So my son is married to this wonderful woman and they've had a baby. So when is it that I, can feel safe to go to the house, and what precautions would you have those folks take as they go visit those babies at the house?
Well, I'm not so sure there's any hard and fast answer to that one, right? I mean, I'll tell you one thing. I guess the better way to put it, there's no good answer, right? Yeah. So I think that, again, it depends on what's the risk factor that grandma has, right? In other words, the bottom line is probably in this scenario, the bigger danger is to the grandmother, not to the mother-in-law, because if she gets infected, she's much more likely to have symptomatic infection. She's more likely to get sick. And so if you think about it, it's how exposed was the mother and the dad and the baby, by being out and about and things of that nature. So again, I don't think there's any hard and fast answer. Unfortunately, obviously, if the mother or if the baby was under suspicion, then you got to wait a couple weeks, right? At least, so-called symptom-based, the same way we choose, I think it's 3 days after the symptoms or 10 days after the onset of symptoms, that you really can feel pretty safe. But again, I think that depends. If grandma's got diabetes and hypertension, a bit overweight and things of that nature, maybe not. And it's a tough one.
I agree. And I think that we've been encouraging that same very things, that we encourage some shared decision making, with the family, but making sure that you understand some of those specific dynamics within the family to make a good and informed decision. That what you want is, we want at a month out for everyone to be able to get to enjoy, good health and new babies. So I know that everyone feels like they need to see everyone immediately. but it's much more important that we're safe and, keep everybody, healthy. This is a question that I think sometimes is, dear to my heart in some of the things that we do. The thing that I have worried about some is, moms that are either pregnant and have decided, to stay at home or they've had a baby. And so they feel like, that they need to stay in and keep the baby, or themselves quarantined. And I've seen a lot of just dialogue about making sure that we are calling out that we want to take care of the mental health, of those moms. And I think it's hard enough to be quarantined. And I certainly remember when I had both of my babies, without COVID, how nervous I was to take those out. And so I think it's the right inclination, to want to stay in and, stay at home per the orders. But anything that you would just, call out on that specifically?
Well, as you know, in pregnancy, and particularly in the postpartum period, we're very worried about anxiety and depression being exacerbated, regardless of this going on. And obviously, it's not only the fear and all the separation and things of that nature of the pandemic, but then you pile on top of that people worrying about jobs, or people have gotten furloughed or laid off or things of that nature. My colleague in mental health here tells us overall, the Southern California suicide hotline that we have, the calls are up like 8,000%. It's some amazing number of people that are being stressed. So again, to your point, I think isolating yourself and doing some of these things, but really looking for the warning signs. Of course, we should be helping you screen yourself for depressive symptoms and things of that nature. And you really, the take-home message and all that is please ask, get help. It's that sort of thing.
I agree. And I just wanted to make sure that we called that out on this discussion about this, because I certainly, if you're at home and you're watching us and you're having symptoms, or you're worried that you have symptoms, of depression, either pre or post your delivery, please make sure that you call your OBGYN's office or some place where you can get some help for those things. We know that that's a real struggle during the middle of this. Well, Dr. Leguru, this has been super fun today to see you. He does great work for us in the Women's and Children's Institute here at Providence. So I've had the privilege of getting to watch some of his work. I'm going to let you have one last, anything else you would like to make sure, you say or anything about COVID and pregnancy.
I'll go back to my comment. The only time we'll get mad is if you don't call. I think that's true of all pregnancies, right? But I think during this time period, now's the time to have a relationship with your provider and your loved ones, and just realize it's hitting everybody. And I always tell people, it's one thing to have an infection, one thing to have pregnancy, and it's altogether another thing to have both at the same time. So that's where we are.
Awesome. Well, thank you so much for joining us today. Your expertise is so appreciated, and thanks for taking time out of your day. If you have joined us, thank you guys for joining us, and please continue to send in questions if you have questions, or for sure, feel free to reach out to any of your providers during your pregnancy. So thank you guys so much, and be blessed.
Cool. Thanks, Dr. Thompson.